Hi, welcome to the Medicare Show. I'm your Medicare advisor and host, Jeffrey Kuhn. This episode, I'm going to be talking specifically about a PPO plan that's in the Rochester, Monroe County, and surrounding county areas that we've seen a lot of people and we get a lot of questions around. It is the only PPO plan that Excellus Blue Cross and Blue Shield offers, and that plan is their Access PPO. We have a lot of folks that travel that like the option of having a very solid out-of-network plan. And a couple things I want to talk about this plan. You should have received a termination notice. This plan is no longer going to be available in 2025, which means you have to select a new plan. Otherwise, you'll be in original Medicare fee-for-service with no drug coverage in 2025. Don't panic. I'm going to go over some of the things you need to know about the current coverage you have and tell you what to do moving forward. We've met with quite a few people that have Excellus's Access plan. They forget they have a $30 quarterly allowance on over-the-counter items that you can purchase, things that aren't covered by Medicare, like vitamins, cold medicines, the whole list. You can get a catalog for them. People aren't using it. One of the most interesting things about it, I probably should do an episode just on this. It's human behavior, just human nature. The example I had a client use was dental floss. They said, "Oh my God, I went to look at the catalog. Dental floss is $4.50. Why would I buy this? I can get it at the store, for $3 or $2 something." And I thought about it, and I go, I know what they're thinking. Why am I going to spend $4.50 or get dental floss that costs $4.50 when I can buy it? So I just listened, made sure I understood the question, and said, okay. So what I hear you saying is, you don't want to use up the free $30 you can get towards any of these items because you'd rather pay out of your own pocket for dental floss that's not costing, whether it's against your credit or out of your pocket. You're going to pay for this now because you don't want to be using up your $30 credit, which is something you get for free. And the lights went off. They're like, oh my God. I go, everything's going to be marked up. I go, who cares? It's free. Order it. So people aren't using it. The other thing is there's a flex card. I had one client in particular, and I always, and it says in everything, you can use it for dental, eyewear, hearing aids. Client hasn't used it. It's got $500 on it. He has to use it by the end of the year. And I've had people try to use it for their cleanings, which are covered, and then the money gets put back on. They're like, oh my God, I can't use the money. You got to use the $500. That's gone. When the plan's gone, that's gone. You've got that credit to use. What do you do for next year? Well, a couple things to take in consideration. I'm not going to talk about specific other plans, benefits, and features. What I'll tell you is this. PPO, there's a lot of confusion around it. Probably the biggest thing, people still have this preconceived notion, if I'm in an HMO, I got to get referrals to see specialists. I've got this gatekeeper. It's not the case. You can always see whoever you want to see, whether it's HMO, PPO. PPO plans are designed to have out-of-network benefits. HMOs, some do. They have a POS plan, HMO POS. They have co-insurance. They might have a certain dollar amount they give you towards out-of-network benefits. Don't make a decision based on referrals. You need to make a decision based on where you might need those benefits. If you're spending extended periods of time outside of an area where there's really good network coverage with that, find out first, is that insurance company in network or not in network? It may not be an issue for you. We have lots of clients that snowbird. Looked up doctors, hospitals, they're all in network. It's a non-issue for the HMO versus the PPO. So don't get hung up on that. What's it going to cost you, right? People look at the PPO and they say, okay, I went on a network. How are the copays on the primary and the specialist? And that's where everything ends. You got to look at the whole picture, right? If you're looking at a different PPO, how do apples to apples compare? Do you have tier 3 drugs? What's the deductible? What is the cost and copays for my tier 3s and 4s? MRIs, CT scans, outpatient. Is there really that much of a difference? So there are other good options, but don't be afraid about HMOs. You have to understand how they work. Picking a plan, if you're getting terminated out of that plan for this year, we've sat down with a number of people and said, really what's important? What do you use? Let's look at a side-by-side comparison and help you understand what fits in best with your situation, including if you're traveling somewhere, meaning you're spending an extended period of time. You're covered now in all of those plans with emergency room and urgent care. In or out of network is covered the same, so don't worry about that. The best thing to do is give me a call personally, and I'll help you navigate. If you got this termination letter or you've got a letter from any insurance company that you currently are insured through, please open it up, because we want to make sure you've got great coverage for next year. And that Medicare booklet I've had, it's really so incomplete. You cannot make a decision just looking at this alone. You really need to talk to me to figure out all the other benefits and what you're going to be best off with. So hopefully that gives you some advice, but you do need to select a new plan. If you are in that Excellus one, you do have some great options out there for 2025, and I'm here for you and to help you make that decision. Thanks for joining me. Bye-bye.